Happy to be back, and I'm delighted to welcome Sue Siegel to our stage. I don't know if you read the little biographical snippet about her in your program. She's a corporate VP at General Electric, and of particular interest to us, the CEO of GE's Healthymagination. Behind that whimsical title is, and I'll use GE's words, a $6 billion global commitment to provide better health for more people by lowering costs and increasing access. And before that, she was a venture capitalist at David Al, and the president of Affymetrix, which
right.
is a pioneering company in genomics. So obviously, if she didn't exist, we would have had to invent her for this conference. But fortunately, she does exist, and she's here. So please welcome her.
Thank you.
Now, so you have only been head of Healthymagination since, what, June?
4.5 months.
Yeah. But before we talk about your vision of it, tell me a little bit about the organization first, as you found it, and what it was there for.
So GE, there's two global initiatives that GE launched, and that was, one is Eco-Imagination, and the other one is Healthymagination. Eco-Imagination was launched in 2005. Healthymagination was launched in 2010. And the purpose of Healthymagination, as Jeff Immelt saw it, was very much around enabling better health for more people. Sounds very simplistic, but when you think about it, what do most folks talk about these days in terms of some of the big crises? Education, energy, and healthcare. No matter where you go, anywhere in the world, that's the conversation. So Healthymagination was put out there to say, well, hold on a second. Instead of us waiting around for someone to tell us what to do, meaning GE, why don't we figure out what we can do and put some things into place to start addressing those three things. And it is very much around quality, access, and affordability. So Jeff put into place, under Beth Comstock,
Jeff
Immelt, I'm sorry,
CEO, yeah.
The chairman and CEO of General Electric, put this initiative into place, and they started doing a number of different experiments, pilots, if you'd like. And those ranged anything from looking at access and quality for medical care in Saudi Arabia, as an example, where you would do preventative screening, for example, for breast cancer in women. Now think about instituting that in Saudi Arabia, all right, where you do have the cultural elements associated to it. And you can't do this alone, so we partnered with the Susan G. Komen Foundation and essentially put into place better access, educated through the Susan G. Komen Foundation, much more of the technicians and the doctors to be able to do this, and really did increase the ability to look for early-stage cancers in women. We've done that now in Guangdong, China, and we've done it in our own backyard here in Wyoming, believe it or not, because when you think about Wyoming being the state that has one of the lowest screening rates in the country, but also a very rural state, how do women that live in Wyoming actually get access to preventative screening? So those were some of the pilots that were going on. In addition to that, there were just a number of things like the Cincinnati Project that, again, Jeff Immelt and the leadership at GE thought, the government or payers or someone is going to do something to us. Why wait around for it to be done to us?
So GE will do it to us?
No. So GE said, why don't we figure out how to partner with the community and with our employees and put things into place that could actually make a difference? And that's what they set out to do. So 2 years ago.
Before that, did GE actually say, we've got great ideas about healthcare, let's go to the existing systems here? Was it born of an impatience that nothing was happening and let's pick it up and do it ourselves? Yeah,
it was born out of an absolute reality of increasing healthcare costs without truly increasing the health of the consumer base, meaning our employees. I mean, when you take a look at that, GE spends over $1 billion a year in healthcare for employees, and it was increasing at double-digit rates. And when that, as you guys know the story of General Motors, right, and how much benefits actually constituted per car. When you start to think about healthcare, it was the same sort of issues that were happening in the big major corporations. GE is a payer, a large self-insured employer. And that's just how,
how many employees?
There's over 300,000 employees at GE, right? And with over 500 sites, it's a big company, to say the least. So one of the things that had to happen is, let's figure out how to do this, and let's not wait. And it was born out of impatience. It was born out of an initiative. It was born out of the desire to make it better for both the employees and also for GE.
So besides like doing breast screening in Saudi Arabia, really a bulk of the stuff that happens in this is, saying, let's use these 300,000 GE employees, and we'll get a grip on our own health costs, which are a big cost for a corporation.
And it's to figure out what other things can we do, all right, and how do we go about doing it. So, there is a program that was instituted called Health Ahead within GE. This was a program that was created with the leadership of GE and the HR teams. Many of you have heard this across corporations, but GE took the GE way and really put a discipline behind it.
What is Health Ahead?
So Health Ahead
is there a separate person who thinks of slogans and names and stuff?
There is a great branding organization, to say the least, within GE. But Health Ahead is a program that, in essence, really allows a whole bunch of different tools for the employee base to be able to access. Anything from programmatic efforts around smoking cessation, measuring certain things with regards to your exercise, the ability to have a health coach, for example, that you could call to allow you to figure out if, in fact, you're following the right sort of regimes as it relates to a medical situation that you might have. You name it, GE was offering it out to the employee base so that employees could be much more educated, if you'd like, and get better access to information. They were not getting the information. So this was one way to help employees make decisions about health. And a lot of you will say, well, my company kind of offers some of those programs and can get engaged, and they last for a little bit. GE took it in a very serious way across the entire leadership of the company, across all the sites, and they really put into place a site certification process. It's very hard. I mean, you guys are going to think this is crazy, but it's very hard to find a brownie at GE. It's, breaks now are really fruits, and it is all about getting healthier because they fundamentally believe it. So it was a very systematic way of addressing the situation with regards to health care. And the testimonials that have come back were pretty amazing, actually.
Really? Because I guess, I'm a corporate employee, and I have to say, and I imagine this is somewhat of a problem in instituting systems like this in health, is that I don't necessarily feel that even though my corporation is involved in the payment of my health, I don't necessarily feel in a sharing mode when it comes to my health and my corporation, right? And, when they offer these, coaching services like that, I imagine an impulse a lot of people would say, oh, I'm going to go outside the corporation. It's almost like watching people, like working out with your fellow workers, right? You want to keep these things separate there. How do you get over that?
There was an initial, what I hear, and I've only been there 4.5 months, so I will tell you the stories that I've heard. And there was definitely an initial sort of, well, hold on a second. I'm not so sure I want the employers to get, my employer to get so involved in my health. What happened over time, I'm told, and I see it now, is people are very engaged with the tool sets that are offered to them, and they've seen the subsequent results with regards to the health. And the fact that, healthcare is social. Change in behavior is social. It's why Weight Watchers and Alcoholics Anonymous and whatnot has flourished over the years, right? And so having, in fact, that others were in the same conversation and really getting addressed socially, if you'd like, made an impact. And, collectively, and I wish we'd collected these stats, how much weight did the entire corporation lose and whatnot? And we probably have it because we measure everything, right? But we haven't publicized that yet, and it is something that I'd love to look into because it'd be a really interesting stat, to say the least.
That'd be a big stack of fat, wouldn't it?
It would be. So when you think about folks at the beginning feeling a bit potentially, how is this going to affect how I am? That, people don't think about that anymore, and they've seen the benefits versus what they
Well, so that happened before you got there. Do you have
issues.
any sense that, was it one killer app that people adopted, or was it was just...
No, one of the things that
there's nowhere else to go?
No. One thing I've learned is it was a mix of apps. It was a mix of the actual physical presence being, the diet changing in the cafeterias. It was the ability to actually measure with the leadership of each of the sites, having to actually account for the things that they had put into place to help the employee base, so they were taking it seriously, so it's part of the leadership culture. The health coaches being put into place, the active sourcing that they were doing directly with the medical suppliers of parts, as an example. So it wasn't just a let's do one thing, which I think, when we've looked at other employers, some of the challenge has been there are these pulses that get offered of these great games, as an example, great apps, and they get engaged for a 3-month period, and then after that, it sort of goes away. How do you sustain this over time? And that is a very systematic approach that is actually put into place, and it's taken very, very seriously across the corporation. I'll give you an example. There is a Health Ahead Day, and it is a stand-down day, and everyone across the world within GE really gets involved. And essentially
what do they do?
It's very programmatic. You get to participate in all sorts of different activities that are actually offered in terms of hikes and walks or competitions.
Really? So I don't go in my desk that day and
you can
I'll
if you'd like. You can if you'd like. I'll give you another example. So there's tread desks now at a number of the sites where you can actually book the tread desk for an hour a day as you're actually on your computer actually doing it. So it's not one thing. It's the culture of health.
Right. And what about in terms of shifting costs and making workers have to watch the cost themselves?
So this is an interesting one. So this is market forces coming to bear, right? Why is it that we don't know how much it costs for knee surgery? Why is it that you don't know when you go to the emergency room how much it actually costs you, right? And you think about that situation. And that's just something that has happened over the years after World War II, of course, and the incentives for employers to provide medical care for their employees. That decision alone and the incentives associated to that has really caused, particularly here in the United States, our addiction to having somebody else pay for our health. So who cares what it costs, in a sense? We've essentially surrendered it and said somebody else gets to pay for it. I don't have to worry about it. What's happened now and what employers are doing across the board is offering all sorts of different levels of health care spend, high deductible plans, lower deductible plans, and all of a sudden people are going, well, hold on a second, I've got to pay for that. Yeah. And guess what? It changes their behavior. It changed my behavior. You choose, well, am I going to go to an urgent care and get a quick take on this, or am I going to go to the emergency room? And those costs, and you know the differences, right? An emergency room can cost you as high as $1,000 a visit, and an urgent care will cost you $45 a visit, right? And you probably will get the same sort of diagnosis if it's not too serious. And I think you're not that sick that you're going to decide to go if you've got, brain hemorrhage, you go to the urgent care center. Those kind of decisions, the consumerism of healthcare, the transparency of pricing has to be put into place for us to actually be able to really work on this healthcare juggernaut. So that decision of actually offering different types of programs was something that was pretty well thought out. And now employees in particular really do look and care about what sort of medical decisions they're making.
So let me ask you, now you've been embedded in the corporate scene for a few months, and this is an area of expertise for you. Was it a mistake to link healthcare to employers? This is a system we've been locked into, but if you were to start from scratch, would you do it that way?
No, I wouldn't. I think that I'm a big believer in individuals being able to make decisions on things that affect them. Mm-hmm. And I think it was an inadvertent consequence of putting into place what needed to be put into place at the time as it related to being able to cover health care after the Great Depression and whatnot, making sure that employers were also safe as it related to providing the health care benefits for their employee base. But when you think about it over time, really allowing market forces to come to bear in health care, like they've been in almost any other industry, why shouldn't that happen? I mean, it's time to do that. And so I think there's a lot of that we're going to see over the next few years in terms of individuals being able to make choices as it relates to premiums.
I want to talk about some other things you're doing there. Before that, while we're on sort of a policy track there,
yeah.
What's the effect of Obamacare going to be on all your activities there?
Well, call it what you may. I think what we really are focused on more than anything else is quality, access, and affordability. Mm-hmm. And what the whole notion of the ACA put into place was, I think, much more awareness for everybody that it is a major issue. And so I do think that some of the choices that are being forced upon them, whether they be state or federal, I'm not trying to take a position here, all I'm saying is GE isn't going to wait for whatever it is that's going to come.
I mean, is it going to make it easier for you? Is it going to make it harder for you? Give us a little food for thought as we go into the voting booth here.
Easier for GE or not easier for GE? Well, I think for the consumer, so I won't speak for GE,
yeah.
For the consumer, there will be an initial element of, oh my gosh, I have to learn health care. Mm-hmm. How do I even start? And I think if there's an area for entrepreneurs and startups to actually think about, it's how to help them make these kind of decisions. Because it's going to be tough at the beginning. I don't even know how to think about it as a consumer. How do I know what's a better premium or not a better premium? I mean, that is something that I think is going to be a little tougher. But I do think ultimately over time, the kind of awareness and education that is being forced upon the U.S. citizenship, from the most sophisticated to those that really haven't had access, is, it's a really interesting time.
Mm-hmm. So I do want to touch on the venture capital and this corporate garage business there. Which is right up your wheelhouse as a venture capitalist there. Tell me about what you folks are doing in terms of engaging with third-party operations and even funding startups.
Yep. So
you're based on Sand Hill Road, right?
We are. So GE, one of the things it did, and one of the reasons why I came to GE, is that the notion of being able to take the venture arm, mm-hmm. which was fairly nascent, about 2 years old, and bringing it into Silicon Valley. So we're opening up our Silicon Valley offices and developing what is an incubator for some of the disruptive sort of solutions that are being brought to the healthcare world. And our venture arm, which is called the Healthymagination Fund, is going to be investing in a number of these types of...
Have you made any investments yet?
Yeah, in fact, the fund has actually made some investments. One I'll tell you about. They've got about 11 investments at this point. And one that, just to give you a sense of some of the technologies. So imagine a colonoscopy without the cleansing. Mm-hmm. A little too visual for you, but... And we invented...
Well, we're imagining without the cleansing.
Without the cleansing. And this is one of the technologies we invested in, which is an Israeli company called CapCheck, which essentially is an imaging device, a pill, that you swallow, and it takes 3D pictures as it goes through your peristaltic, through your intestines, and takes pictures. And wouldn't that be nice? You can go golf and have a colonoscopy at the same time. I mean, it's just very cool. So it's really bringing new technologies to bear that, frankly, we wouldn't have looked at in the core businesses.
Right.
That's out there for a little bit. And we're going to look at healthcare services, too, which are disruptive. Like we just heard about the telemedicine world, which is fantastic. It has to go there. I think we all know that convenience is going to be something really important to all of us. So we're looking at all of it, and the notion of the corporate garage is also around what we're calling the scalerator, and this is someone's invention within GE, and that is bringing GE scale to help startups get to scale faster. So one of the things we'll help do is, how do you figure out GE? How do you even find the right people within GE to actually make this happen? We're going to be your Sherpas, in essence, within GE to find you the right expertise and hopefully be able to help some of these startups actually get to scale a little bit faster.
Okay, so we don't have time for questions of the audience. There is one comment on Twitter I will bring up, because you mentioned the food you have at GE. So you don't have junk food anymore or desserts, things like that. Someone from Twitter basically said, well, doesn't think very much of that. Removing brownies doesn't foster willpower or self-control. Actually, have you found that people are healthier by just forcing, kale on them during the day?
I have to say, people will tell you, in fact, they'll actually provide testimonials, even on the website they'll do this, that they have found themselves to be healthier. So far, so good. I mean, we know that nutrition...
And you're not monitoring them. You don't have one of those scanner radar things.
No, we are not monitoring them. Big Brother is not there. No.
Well, that's good. Well, and comforting to know. So thanks very much. And,
Thank you.
Enjoy talking to you.